started your timer and here is your question. Right, so if you have read and understood considering a critical care scenario, kindly tell me how do you intend to manage this patient?
I intend to manage the patient using the CRIPS protocol.
Yes.
I will check the patient's airway to check that the airway is patent. If patient is able to tell that means the airway is patent, then check the breathing of the patient and examine the trachea if it's central or if it's displaced. Then check the expansion of the chest on using my hand on both sides, and then also check the across the chest. There may be changes in the chest. That it may be that be dull or hyperresonance, depending on whether there is a pneumothorax or pneumothorax. Then auscultate also through the chest, and then I will assess the patient cardiovascular system, check the patient, the pulse, know whether it's regular or not, and then check his BP also, and listen to his heart to check for either there is murmur and
How would
percent.
you, yes, confirm your diagnosis?
Then
What
check
is your
for
provisional diagnosis?
and then
What?
as get secure IV line
Yes.
for him to take my blood test samples and then give him a fluid.
Yes, I said, I asked you, please, what are the provisional diagnosis or the differential diagnosis that you'll consider why patient is having sudden sharp chest pain?
Okay,
while you were inserting the line? Yes.
is my differentials are a possible pneumothorax, also
Yes.
a pneumothorax also is possible.
What are the types of pneumothorax that you know of?
The types of pneumothorax, it could either be simple pneumothorax or
Yes.
tension pneumothorax.
Yes.
Then it
Can
could
you
also
please
be
tell me the differences between simple and tension pneumothorax?
for tension pneumothorax, there is a patient will be hemodynamically unstable.
Yes.
In tension pneumothorax, but in simple pneumothorax, there is only presence of pneumothorax, but patient is hemodynamically stable.
Okay, anything else?
Then for the pneumothorax could also be a primary or secondary.
Yes.
The primary is when there is no any underlying cause to the pneumothorax. While in secondary, there may be due to trauma or a
In
rupture of
case of tension pneumothorax, what type of shock is present?
the shock that is present is a the patient has a distributive shock.
Distributive shock. Very good. Because there's a compromise of cardiovascular system. Very good. Okay, can you please tell me, keeping the NICE guidelines in your mind, what is the mistake which has been done while inserting the central line in this patient, this which has resulted in this complication?
Using the NICE guideline in check
Yes.
in the patient, the procedure is supposed to done under ultrasound guidance. Then the patient
Very
is
good.
placed in Emborg
Very good.
procedure.
Okay, so what is the technique which should have been used, keeping the NICE guidelines in your mind?
They should use the Sedinger's technique in cannulating the vein.
Yes, can you explain it? How should be the
Yes.
patient? What was the should have been the position of the patient, and how it should have been
So the
inserted?
patient should be positioned in a Trendelenburg position.
Yes.
person passing it stays at the head of the patient. Then patient is usually the right side is used. So the
Okay.
patient's neck is done to the left, and then the cleaning of the that particular area is done. Then
Yes.
the two points are the two insertion of the sternocleidomastoid muscles are located both on the clavicle and then also on the sternum. So in between these two heads, the carotid pulse is palpated, and then just lateral to it is the location of the
Okay.
internal jugular vein. So
Good. Can you please
the
tell me?
needle is
Yes.
passed at
Yes.
30 degrees to the skin, and then directed towards the ipsilateral nipple. So once blood is, then the needle is the syringe is aspirate is withdrawn. Once blood is coming out, then it is stopped, and then the cannula is passed over the syringe using the Selinger technique.
Yes, and then even the suture line is
And then yes,
it is sutured and it's secured.
Like to attack to secure it.
Okay, can you please tell me the surface marking of internal jugular vein?
The surface marking of the
IJV.
okay, the interventricular vein.
IJV.
Okay,
Internal
the
jugular
internal
vein.
jugular vein.
Yes.
Okay, the surface marking comes from the
lobule to medial end of clavicle. Okay, can you please tell me, there are certain indications when you have to remove the central line. Can you name few?
Yes, indications to removing the central line is when there is no need. There is no need to retain it. The purpose for its insertion has been accomplished. When there is infected, if it is infected, and if there is a thrombophlebitis affecting the internal jugular vein.
Okay, can you please tell me what is the technique, ideal technique that should be used to remove the central line?
Okay, the patient should be placed back in Trendelenburg position when it is to be removed, so as to prevent air embolus. And then once it's removed, the place should be closed and dressing applied.
Okay, can you please tell me, just like this patient, patient had sudden sharp chest pain. So what are the ideal investigations that you should do to rule out or confirm your diagnosis?
A plain chest radiograph, plain chest radio X-ray will be done to confirm the diagnosis.
Okay, this central line can be a source of infection as well. Can you tell me what organisms are involved or can occur?
Usually Staphylococcus aureus. So Staphylococcus epidermis.
Yes. Can you please tell me how would you make sure to prevent the infection of the central line from happening?
Yes. During the insertion, usually the aseptic is applied under aseptic protocol. The skin will be prepped, and then surgical gowns and drapings will be used during the procedure. And then after that, when there is any contact with the cannula, there will be washing of hand before and then after its use.
Okay, can you please tell me what is the location where central line should be inserted, or if you can tell me the boundaries of the safe triangle?
The locations are the internal jugular vein, the subclavian vein also, and then also the femoral vein can also be used to place a central line.
Yes.
The second question, I didn't get.
Safe triangle of insertion of chest tube, if you have to
the
do
safe
it.
triangle of the insertion of the chest tube, the apex is in the axilla.
Yes.
Then the inferior part is the fifth intercostal space. Then the anterior border is the lateral edge of the pectoralis major, and then the posterior edge is the mid axillary line.
Okay. There are certain indications for or reasons for inserting central line. Can you mention few?
they includes they are for administration of fluid for the
Yes.
patient, then also to monitor the central venous pressure, and then also in hemodialysis for patients.
Yes.
Then also for
Yes.
total parenteral nutrition.
Yes, and yes, transvenous cardiac pacing, etc. Good, thank you. Yes, can you please explain what you're looking at, the image? What would you look for? The ABCDs?
Okay, the airway, there is a displacement of the trachea towards to the left on the
Yes.
radiograph, and then also
Yes.
there is a displacement of the heart also towards the left side. I may not be able to say that is big now or not. I need to measure to know the cardiomegaly. Then
Yes.
there is a widespread opacity on the left lung zone.
Yes.
Then on the on the right, I can't see the lungs marking very well, and there are prominent dilated
Yeah.
vessels on the upper lung zones.
Yes. Good, thank you. And then the stomach is also in the chest, herniated.
Okay.
And exposure is maybe not adequate. Costophrenic angles in air below the diaphragm is not visible on the left side here, anything. Yeah, so more or less what you told. Good, thank you.